Hey guys, welcome back to my channel. This is Addie's Corner. My name is Adija, but people call me DJ or call me Addie. Today will be a little bit different just because you'll be hearing my voice and not necessarily my face. And we'll be talking about substance use disorder, in particularly opioid use disorder, and what treatment such as Narcan, the nasal Narcan was the one I'll be focusing on in this topic or channel today, and what to do when people have an experience or when you see somebody overdose on medication. But before I start, I would like to put a disclaimer out there. This is just for learning purposes and, of course, not a substitute for medical advice, diagnosis, or treatment. Call 911 if you think you or anybody is experiencing any medical emergency. So let's just putting that out there, but let's get started. So what are opioids? Opioids are a class of drugs that helps with pain management, pain relief. Often we see it in common drug that we see is like fentanyl, the oxycodone, methadone, morphine, tramadol, codeine are some of examples of pain management that we've seen, we've used ourselves personally. These opiates, there's opiates such as codeine and morphine comes from a poppy plant, and this may come in tablet form. You'll see it in a pill, in a capsule, in powder or liquid form. And how do they work? How does opioid works? Opioid attach to and activate receptors found on nerve cells in the brain, spinal cord, gastrointestinal tract, and other organs in the body to provide physiological effects. Meaning, wherever there is a pain or wherever you're having any type of pain, the way opioid work is there's a receptor there, and opioid attached to that receptor, that the nerve cell there, to help reduce your pain, to help relieve that pain that you're having. Essentially, opioids are a broad group of pain relieving medicine that works with your brain cells by blocking the signals between the brain and the body. Unfortunately, when abused or misused, some severe side effects may occur, such as numbness, addiction, respiratory depression, meaning like your breathing become very slow, and often leading to death, overdose death. And we see this, of course, in the DC area particularly. We see this happening to African American men that are suffering from opioid abuse, and also having a higher rate of opioid death or opioid overdose deaths, essentially, is what I'm trying to say. The pleasure of feeling high that result from taking an opioid can make one feel like they want to continue taking the medication, or they need higher dose to help them get the same relief or get the same pleasure that they once had. One can easily reduce the possibility of dangerous side effects by following doctor's order, or just taking the medications that were prescribed to you. Do not take friends' medication and things of that nature. But at this time, we will be shifting gears. Now, I'll be talking about how to recognize an opioid overdose, some side effects or some signs and symptoms, not side effects, sorry. Some signs and symptoms are unresponsiveness in voice or touch, blue or purple fingerprints and lips, slow heartbeat and blood pressure, slow, irregular, and stop breathing. Pale, clammy skins are some of the potential side effects. And once you see this or you recognize that there's a potential of opioid overdose, I will encourage you to call 911 and get emergency medical assistance immediately. You can save life by just doing that, and also, of course, having Narcan on you. This is because there has been an increase in opioid related overdose deaths in the past decade. Drug overdose is now the leading cause of accidental deaths in the United States, even more than car accidents. In the next video, we'll be talking about Narcan. Naloxone is another name for it. How does it work, its mechanism, and how to use it. I do want to say thank you again for watching my video. This is Addie's Corner. If you do have any suggestions on how to improve my videos or topics that you'd like for me to discuss, please share in the comments, as I will be taking it into consideration. We are all learning here. It's as much of a learning experience for you guys as it is for me. And see you next time. And thank you again for watching. This is Addie's Corner. Toodles!